Nursing students, a runny nose is a deadly emergency in only one instance, and this is that instance. You have got to be able to recognize it. This is an NCLEX case study of a 36-year-old small business owner who fell about 15 feet from a ladder while she was hanging decorations in her store. She hit her head. She did lose consciousness for about a minute. EMS transported her to the ER where she did vomit 3 times en route. You got on arrival a set of vitals. None of them are looking great. We got blood pressure 178/64. Heart rate is 56. Her respiratory rate is 11. SpO2 is 96% on room air. Her Glasgow Coma scale is 13. Her pupils are equal reactive. About 2 minutes later, the patient says, I've got a runny nose. Can I get a little bit of a tissue? She is a little bit confused, but she is asking, she's like, it's bothering me. Can I please get a tissue? The nurse notes clear rhinorrhea. This should automatically make you panic. If you don't know yet, you about to. What does this signify? This case study, what do you think is going on with this patient? You have 3 seconds to answer. 3, 2, 1. This is most likely increased ICP, probably due to a brain hemorrhage from falling. But when somebody has a clear runny nose after a head injury, this could actually be a CSF leak. So we will test this fluid to see if it is a CSF leak. What is the test that we do for that? You have 3 seconds to answer. 3, 2, 1. That is called a beta-2 transferrin. Now, we used to test it just for presence of glucose. You will still see that in some hospitals. We say, like, you're going to test it for glucose. If there's glucose, it's CSF. If it's not, it's not. Get it? Okay. What is a normal ICP? You have 3 seconds to answer. 3, 2, 1. Normal ICP is going to be between 5 and 15. All right, this patient continues to be in the ER. You go in about 30 minutes later. You note that she looks like this. This should also make you panic. What is happening in this picture? You have 3 seconds to answer. 3, 2, 1. This is decorticate posturing. This is a sign of neurological deterioration. When you have a patient that you think they have increased ICP, it's higher than 15, how should you normally position this patient? You have 3 seconds to answer. 3, 2, 1. Neurological patients that we think have increased ICP, the nurse should position the head of the bed at 30 degrees and keep the head midline. If somebody has increased ICP, and we know because we did a beta-2 transferrin test, what is the drug of choice that we typically use to treat increased ICP? You have 3 seconds to answer. 3, 2, 1. We are going to treat them with IV mannitol. Mannitol is a osmotic diuretic that is going to pull fluid from the head down. I will have a full ICP video on YouTube that I'm going to be posting tomorrow. So head over to YouTube to get way more in depth on a plan of care for increased ICP.